Okay, so good evening, one and all. Today we are here for the SKIP session 9, which is on the topic Understanding Forensic Odontology by eminent speaker, okay, Dr. Harikrishnan KP. He is a BDS dental surgeon, and he has also taken his master's in forensic odontology, okay, from the Gujarat Forensic University. So it is my pleasure to welcome the speaker of day, Dr. Harikrishnan KP. Welcome, Doctor, to this session, SKIP session 9. Okay. Next, I welcome my colleague, Dr. Rino Rubak-Suomen, who is the backbone behind this program. Okay. Welcome, Dr. Rino. Then I welcome all my students, especially the third year students and the final year part 1 students to this session of SKIP. I hope this session will be definitely exciting to you, especially because Dr. Harikrishnan is working in the Department of Police as a forensic odontologist. He is a consultant in the Kerala Police Department. So he will make this session more exciting. So before I go on to the session, let me ask Sandra, the student coordinator, to briefly introduce our speaker of the day. Yes, Sandra, can you introduce our speaker?
Hello, sir. Am I audible?
Yes, yes. Yeah, continue.
Okay, today we have Dr. Harikrishnan KP here. He graduated BDS from Amrita Dental College, Kochi in the year 2006 and worked as a dental surgeon from 2012 to 2014 in Changnasheri Government Hospital. He started private practice in the year 2012 at Chennitala. From the year 2015 to 2017, he took MSc on Forensic Odontology at National Forensic University. In 2018, he got a certificate course in the implants novel biocare. He's a regular forensic consultant with the Kerala Police and maintains a 10-year-old clinic at Chennitala. He's married to a dental surgeon with 2 children. We are glad to have you here, sir.
Thank you. Thanks.
Yes, Dr. Hari, you made the host. You can start the presentation.
Okay. I'll do a PowerPoint presentation, sir.
Fine.
Side by side, I'll be discussing it with the students. Am I clearly? Am I audible to everyone?
Yes, audible ആണ്. Video കാണുകയും ചെയ്യാം. Presentation share ചെയ്തു.
Okay, okay. കാണാമല്ലോ സാറേ?
Yes, yes, കാണാം. Continue.
നമ്മുടെ ഇതില് എങ്ങനെ സാറേ ഇത് if everyone who is attending this class is a Malayali or there are people from outside the state as well?
No, all are from Kerala itself. Outside state ആൾക്കാരില്ല.
ആൾക്കാരില്ല. അപ്പം നമുക്ക് കുറച്ച് മലയാളമൊക്കെ ഇടയ്ക്ക് പറയാമല്ലോ.
Yeah, no problem.
Okay. അപ്പം നമ്മുടെ ഗുഡ് ഈവനിങ്. നമ്മുടെ ടോപ്പിക്ക് ഇന്നത്തത് അണ്ടർസ്റ്റാൻഡിങ് ഫോറൻസിക് ഓഡോntology എന്നുള്ളതാണ്. നിങ്ങൾക്ക് എല്ലാവർക്കും അറിയാവുന്ന പോലെ. ഞാൻ ആദ്യം എന്നെ പറ്റി ഒന്ന് പറഞ്ഞു. എന്നാലും ഞാനൊന്ന് പറയാം. എൻ്റെ പേര് ഹരികൃഷ്ണൻ എന്നാണ്. ഞാൻ I did my BDS from Amrita School of Dentistry, Master in Forensic Odontology, which was actually an MSc then from National Forensic University, Gujarat. ഞാൻ ഒരു 10 വർഷമായിട്ട് ഇവിടെ ക്ലിനിക്ക് നടത്തുന്നുണ്ട് ചെന്നിത്തലയിൽ. അത് ഭയങ്കര ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള ഒരു കാര്യമാണെന്നാണ് എനിക്ക് തോന്നുന്നത്. കാരണം എന്ന് വെച്ച് കഴിഞ്ഞാൽ ഒരു ഫുൾ ടൈം ഫോറൻസിക് ഓഡോntologist, ഒരു പാർട്ട് ടൈം ഫോറൻസിക് ഓഡോntologist, there is a huge difference between both these professions. I am actually a part-time forensic odontologist and a full-time general practitioner. So occasionally, I get consultation from Kerala Police and other agencies like Fire Force, etc. നമ്മൾ ഇന്റർപോളുമായിട്ടും ലിങ്ക് ചെയ്യാറുണ്ടായിരുന്നു, ഇടയ്ക്ക് ഞങ്ങളുടെ ഒരു ടീം ഉണ്ടായിരുന്നു. ബട്ട് ഐ ആം എ ഫുൾ ടൈം general practitioner in general dentistry in my clinic and a part-time forensic odontologist. Okay. What is forensic odontology? Basically, we have to understand, this is not about understanding or by hearting any definition, but just you have to have an idea what is forensic odontology. We can all listen to this. This is a branch of forensic science which deals with collecting, preserving, and interpretation of dental evidence. From where? From it can be a crime scene or from a disputed case, which we will be talking about it later. And this is completely under the court of law because you are working under a law to offer law enforcement. This is forensic odontology. So what are the scopes? Scope in the sense, what I mean is that what all can you do with forensic odontology? So just like any other branch of forensics, we can do age estimation, sex determination, person identification, which is a very big thing, and DVA means disaster victim identification. And of course, when you get a DNA, you need to know the basics of DNA. Actually, we are not the one who is supposed to do the DNA analysis. There are biochemists and experts in DNA analysis. Our duty is to collect DNA and for check for DNA presence in the crime site or from the possible fragmented remains which is available in the crime scene or may be a disaster site, etc. So we'll collect the DNA and then we'll hand over it to the experts who has a special interest or a special expertise in analyzing and then collecting, doing the DNA job. So application of forensic odontology in dental practice is another thing. So every general dentist has some duty which can be done in day-to-day dental practice, which is related to forensic odontology. That I'll be explaining later. And in research. And this is the main thing which is related to forensic odontology because research is an endless, research has an endless scope in forensic odontology. Most of the area is untouched in forensic odontology, it seems, because this is a lately developed field and then there is a huge scope for research in this field. One by one we'll explore. First one is age estimation. So what is age estimation? As you all know, you are, I guess you are in third years and final years. So most of you might be knowing the difference between normal age and dental age. What is a dental age? Dental age, there are a particular period of time from for every individual where each tooth erupts. For example, the lower anteriors, it will be erupting in 6 years, approximately 6 years of a child's life. Lower first molar, almost same time. So we know that. So using dental eruption pattern and the teeth present in an oral cavity, we can analyze a patient's as well as a dead bodies or a fragmented remain or anything, anything which we have related to the dental section. We'll find out the age. This is the age estimation technique. So what are the need for age estimation? In case of disputes, for example, dispute in the sense a person who is going to inherit some property after 18 years of age. He claims to be 18 years of age, where someone is claiming that he is not 18. So then there comes a dispute. So we can we can take an OPG. So that is one way where we can come into the legal section. We'll find out the which all tooth are present, whether the tooth present, which has to be present at the age of 18 is there. And likewise, we can come into the legal aspect of it. So in case of asylum seekers, asylum seekers in the sense people who are seeking for accommodation in some other place, like if there's something happening in some countries like Jaffna and all, and people are then migrating towards other countries. For example, some Bengal people are coming into India seeking for seeking a citizenship and all. Then sometimes this government will start a they'll make a new rule that okay, people till 21 years are given asylum here in India. So how do you analyze whether people are over 21 years of age or not? So here comes dental again. You can just simply take an OPG and then you can find out whether these are just small examples. So I just want you to understand what is happening in forensic odontology, so that this may not be the exact thing, but this is what we can do in forensic odontology. So in case of unidentified fragmented remains, etc. So you are in a big mass disaster cases. So you are getting 100 dead bodies, which is mutilated, severely mutilated, and then it is fragmented. The facial, soft tissues, everything is gone. You cannot identify the person. So at least by providing some clue about this person would be a great help for the people who is finding for the person identification. Of course, we can do person identification. That is a different thing which will be coming to it later. So in fragmented remains, even if you get a small part of the jaw, if there is some kind of deciduous or permanent teeth present in this, you will be able to find out the age. So some methods, I'll come to some methods. Using an OPG, can we do this? For example, in this case, we can almost guess the age. Even if you get an IOPA also, a very small part of the jaw, which we'll be taking an IOPA, and then if you are finding some tooth buds inside, we'll be able to find the age. So that is one method using radiographic methods. And age estimation can also be done with developed techniques. Some of the developed techniques which I would like to mention here, these are the basic things, are Demergem method, dentinal translucent method, etc. So just I'll show you the Demergem method chart. In this study, what they have done is that they have classified, they have studied a great population, and they have studied the eruption sequence, I mean the calcification sequence of the tooth buds. So they have rated it into different stages, starting from no evidence of calcification to completely closed pulp chamber at the apex. So you can, is the picture clear? Can you just see the pictures? Hello?
Yeah, pictures Doctor.
Pictures, okay. You can see the stages. The first stage is cusp tips are classified, but have not yet fused. Just the cusp tip is classified as stage A, and then the fused calcified cusp tip is the next one. And from that, it comes to the stage H, where the tooth is completely formed. And this stages, we are going to evaluate each and every tooth from an OPG. OPG from an unidentified body, and then we'll find out the age, substituting these sequences into an equation which is already there. Now, dentinal translucency method. This one, you can relate it to the clinic as well. because once if you have started doing root canal treatments, you'll be able to understand this. When you get a very young individual for root canal treatment, you'll have a big pulp chamber. But once you get an senior citizen, I mean 55 plus, 60 plus, 70, then you'll have a big trouble in getting the access to the pulp chamber, because the pulp chamber will be narrowing down. I guess you all know that. So using this technique, they have classified in that is known as this Dandelion translucency method. Here, secondary dentin formation, this is based on secondary dentin formation. So in very young individuals, you'll have no secondary dentin formation, and then a big pulp chamber you'll have. And gradually, when they have classified all these things according to the age, and when you get a senior citizen who is 60 plus, you'll have a completely, not 60 plus, a very older person will have completely fused, completely calcified pulp chamber. Based on these things, these are just basics, and you will not be able to understand a technique, an age estimation technique, in just a 1 hour class. You need at least 3-4 hour class to understand the exceptions, how to do all these things. I'm just brushing through the basics. Just let me know if you have any doubts in between. You can interrupt me anytime. Okay, no problem. And now, for coming back to the topic, so an young individual will have a big pulp chamber, and an elder individual will have a very calcified pulp chamber. So with that also we can find out the age. So moving to the next topic, we have done with the age estimation techniques. Now sex determination. So sex determination, usually we are using sex for determining the sex, the skeleton. So in our aspect, we are considering the skull, skeleton, and we are using different portion of this skeleton for sex determination. So I'll show you a YouTube video. You can see this.
Sex differences in the skull. There are no sex differences until puberty. The post-pubertal differences are as follows. The weight of the skull in males is heavier and in females is lighter. The size is larger in males and smaller in females. The capacity is greater in males, and it is 10% less than that of males in females. The walls of the skull are thicker in males and thinner in females. Muscular ridges, glabella, superciliary arches, temporal lines, mastoid processes, superior nuchal lines, and external occipital protuberance are more marked in males and less marked in females. The tympanic plate is larger and the margins are more roughened in males, and it is smaller and the margins are less roughened in females. The supraorbital margin is more rounded in males, while it is sharp in females. The forehead is sloping or receding in males. It is vertical in females. Frontal and parietal tubera are less prominent in males, whereas they are more prominent in females. The vault of the skull is rounded in males, and it is somewhat flattened in females. Contour of the face. In males, it is longer due to greater depth of the jaws. The chin is bigger and projects more forwards. In general, the skull is more rugged due to the muscular markings and processes, and the zygomatic bones are more massive. In females, the facial bones are somewhat smoother, and mandible and maxillae are smaller.
So these are the main differences with which you can identify the sex in individuals. So is it possible to find out sex with a tooth? Let's come to that later. Person identification.
What's up, Ninja Nerds? In this video today, we are going to be talking about the anatomy of the skull. Just to give you guys a little bit of info, these actual skulls and all the other anatomy models that we're going to be using throughout these anatomy series is brought to you by the Anatomy Warehouse.
Okay, sorry for the interruption. Person identification. This is another specialty of forensic odontology. In mutilated bodies, you need to identify which person is this, and so that their last rituals can be carried out, their citizenship can be found out. There is many more to it. Mutilated bodies, from mutilated bodies, how do you identify the person from dental and from dental parts? So this is a disaster victim identification. Our another topic. This is disaster victim identification. In disaster victim identification, we play a crucial role in disaster victim identification. This is a newspaper cutting from where this 9/11. You all remember how 9/11 attack happened, and then there was a lot of casualties, and there we forensic odontologists played a great role in identifying the mutilated remains. So how we are doing this? Just like fingerprints, our dentition is unique to each and every individual. Not even identical twins will have the same dentition. You all know about rugae also. Rugae is some small muscular folds found in the mucosal folds found in the hard palatal region. And this rugae is also different from each, it differs from one individual to another, just like fingerprints. They all are unique. Lips. The study of lip prints is known as kiloscopy. Lips also are different in each individuals. Tongue prints, yes, they are also different. The pattern of enamel microscopically is also different from each individuals. And the study of enamel pattern is known as amyloglyphics. And there are many more to it. Coming to dentition status, I'll explain each one in detail. Dentition status. One individual will have a particular signature dentition, and that will never be found in another individual. We have studied this twins, identical twins. So we have gone to a village in Malappuram, which is known as Kodingi. There they have lot of twins. Almost every other house has a twin there. Identical twins, unidentical twins. You can Google about Kodingi village. Yeah, and we have studied almost 10-20 for our thesis in Kodingi village, 10-20 identical twins, where none of them had identical dentition status. So this can be used once you have an impression in some dental clinic. You can compare that. If you have a cast in a dental clinic and then you are suspecting this person is dead, and then you can recover this cast from the dental clinic, and this can be used as a to compare it with the mortal remains, and then you can find out the person. This is accepted legally. Well, rugae, these are the folds which are found in the hard palatal region. How do we use them? This can only be used for person identification, and this is not accepted as a primary evidence or a primary acceptable evidence in court, but this is a supportive evidence. So you can compare this rugae with the mortal. How do you find this rugae? This rugae will be found out in some clinic by accidentally. This person has gone to a clinic, and then they have their his cast made up in the clinic, and then you take this cast, you recover this cast with proper legal channel, through proper legal channel, and then you compare it with the mortal remains. So here I would like to tell you, for example, in case of a burn death, a person is unidentified because once the temperature goes around 670 to 810 degrees Celsius, almost all the soft tissues in the face gets destroyed, and this person will be completely unidentified. Only the hard tissue, hard part of the bone, which is the skull, will remain. So here, even in this temperature, up to 1000-degree temperature, what happens is that the buccal soft tissue and the tongue, the muscles of the tongue, acts as an insulator. And then these things will take up all this heat and or they'll burn down, and they'll never let this, in most of the cases, they'll never let the palate or the dental or the tooth, they'll not be destroyed, because these buccal soft tissues and the tongue will act as an insulator. They'll take up all the heat and they'll preserve these things. So once you have a cast, this can be used to identify a person. Next one is kiloscopy. Kiloscopy, just like fingerprints, you have different types of lip prints. And there is a classification. I think there are 3-4 classification for lip prints itself. So there are different types of lip prints. There can be combination of all these things in an individual, and one person's lip print will never match another person's lip print. So this is a very funny thing. From a crime scene, you are getting a glass which is half empty. So you want to find which person was there in the crime scene and who drank from this cup. You can pick up the lip print from this cup, and then you can compare it with the suspect. And once the comparison is complete, then it means that this person was there in the crime scene. It's actually acceptable in the court. So just remember, the study of lip prints is known as kiloscopy. Amyloglyphics, just like fingerprints in the sense, it's all unique. One person's amyloglyphics, I mean, the pattern of the enamel will be different from other person's enamel. So it can be, the enamel rods will be running straight or in a diagonal way, or it can be in a circular, ovoid, or any other way, which is actually unique for each and every individual. So these were the techniques for person identification. I am just going through the basics. These are the techniques for person identification. Now, moving to another very interesting and then legally very important thing in forensic odontology is bite mark analysis. Bite mark analysis, we are using very frequently bite mark analysis over the world to find out the culprits. So animal bite mark is also a portion of study. We have to go into that as well, because animal bite mark is entirely different from human bite mark, because animal's dentition status is different from human. We are now talking about human bite mark. So what you are seeing in this picture is an ABFO number 2 scale. ABFO stands for American Board of Forensic Odontology, and number 2 scale is used for bite mark analysis over this period of time. And then these have small markings which we are using to avoid the what do you say for that? You take a picture and then you'll have some distortion if your picture is angulated, or you are taking from a side, and then you'll have distortions in the size and shape of the picture. So we are using this scale. We'll place the scale over the bite mark, and then we'll take the photograph. And once this photograph is moved into the software, we'll just make sure that the 1 centimeter in this ABFO scale vertically and horizontally corresponds to 1 centimeter, let's say in Photoshop. In Photoshop, you can measure, or in some other softwares, you can measure centimeters or millimeter in the picture. So we'll make sure that 1 centimeter in this ABFO scale corresponds to the 1 centimeter marking in the Photoshop, so that we are avoiding distortions. And then what actually we does is that we'll never get one thing I would like to remind you, we'll never get a clear bite mark from a dead body. It will be called very maybe 3-4 days later. So the bite mark, we have to guess a little. And then we'll be getting a bite mark here. We'll be taking this, and then we'll have 3-4 suspects, and then what we'll do? We'll take the impression of all these suspects, and then we'll try to superimpose the incisal tip over this bite mark, and hopefully it matches. And then the culprit is, we have the culprit here. So basically we are using superimposition techniques. We'll mark the incisal tip, and then we'll find out which one best matches the bite mark in the dead body or in a, let's say, a rape victim. So even now I would like to tell you that this is not a primary evidence, this is a supportive evidence. So we can do another thing. What we'll do is that we'll just swab this area, this bite mark area, from the suspect's, from the victim's body, where the bite mark is. We'll do a saline swab, and then we can send this swab for DNA analysis, hopefully to get a DNA extracted from this site. So this is bite mark analysis, and now DNA. Coming to DNA, DNA is another thing which is a vast thing in forensic. So basically, what we have to do is that we need to know from where we can gather the DNA from a crime scene. So coming to you are sent to a crime scene, where when after inspection you'll be find you have 2-3 cigarette butts. Like just now I said, some glasses, empty, half empty glasses. And so what you have to do is that from this cigarette butt itself, you'll be able to find out the DNA. So how to transport these things? This cigarette butts has to be taken, and then of course with a gloved hand, and then you'll be putting this in a paper cover, and then this will be transferred to the nearest lab, the government lab. Then they'll do this. Just be aware that which all places has to be checked for a DNA. Being a forensic odontologist or being a dentist, you know how much buckles of tissues or the tissues from the mouth can be transferred into a glass while you are sipping a drink, or while someone smokes cigarette. You can transfer some DNA through the saliva, or directly from the cells from the buccal soft tissue, or from the epithelial lining, or from the tongue. This can get entrapped in the cigarette butt, and that is enough to find out the DNA. So DNA from teeth. So this teeth, usually what happens is that